Hi, my dear parents. Welcome to Growing Right, a podcast by Ankura Group of Hospitals, where we are trying to deliberate into specialized pediatric care and its role in improving children's health, how it plays a role in children's health on a day to day basis. So, it is always a challenge because now pediatrics is more diversified. It is not only about fevers, vaccinations, there's a lot more associated with pediatrics. So, as a part of it, we have a group of specialized people in pediatrics, people who have specialized, subspecialized in pediatrics, like different fields of pediatrics, who are with us at associated with Ankura, who will be coming to this podcast and giving their insights on regarding children's health and what else we can do and what to do and what not to do. So I am Dr. Suman, consultant pediatrician, senior consultant here at Ankura Hospital, and I've been practicing for the last 20 years. And my interest is general pediatrics, pediatric allergy, pediatric asthma, pediatric nutrition, and growth disorders in children. Today, I have with me one of the most charming and one of the most friendly, child-friendly, parent-friendly pediatric endocrinologist with me, Dr. Mounika. Welcome, Dr. Mounika, to the podcast.
Thank you so much, Dr. Suman, sir.
It's,
I'm really excited and I'm eagerly looking forward to share my insights.
Thank you for being here, Ma. It's actually, for me, it's a blessing in disguise that you are with us, because still you are, when we didn't have you. As a matter of fact, I had a lot of challenges as a pediatrician because a lot of parents come to us with a lot of growth related issues.
Right.
Some might be overwhelmed, means the parents might be overly concerned. There might not be any issue at all, as I've figured out when I've started referring patients to you.
Right.
Because parents show so much of concern. As a pediatrician, we are not alarmed, but sometimes we do get alarmed because of the concerns of the parents. We do send it across to you, and you just dissipate it, saying that there's nothing in this child. The child is absolutely doing good. I think that's a blessing to always have people who can share knowledge, help parents out. So thanks a lot for being with us, and thanks a lot in this podcast. I'm sure by the end of this show, a lot of parents would be educated regarding their growth concerns of the child.
Sure, sir. Yeah.
Normally, children, for the first 2 years of life, there's so much of impetus on making the child look fat.
And fat, yeah.
For them, they should be so fat that the neck should not be visible, and when they stand, the thighs, the gap should not be there, and they are considered as healthy children.
Healthy. Yes.
People who are very lean and active, they're smart, they don't have any vitamin deficiencies, they're running around, they're considered as weak. So they took lean as weak.
Yes.
So my experience, you can differ with me. My experience, most of the parents who push their kids for the first 2 to 3 years, as far as appetite is concerned, they keep pushing them. Majority of them, after my 10 years of practice, I see them that majority of them have become either overweight or obese. Now I have seen them parents coming back to me at 10 and 11 years, sir, how to decrease his weight?
Correct.
How to, my son is really becoming, obese. How to decrease his weight? We are really concerned about it.
Right.
So this is what I used to, make fun of them. See, when he was young, you were after him for not being fat, and now you are after him for being fat. So that being after him is a common thing there. So what are your viewpoints as far as when we think is a cause of concern, being a pediatrician, as far as the weight and height is concerned, when should we actually take your help? That is something which is very essential for our pediatricians.
Right. So I would say that if you see a child who is overweight or obese, so how do we, differentiate that what could be the probable cause of this overweight? So, sir, as pediatricians, probably you will be dwelling into the causes, like the lifestyle causes, like how much is the calorie intake of the child? Is he eating too frequently? Are the parents overfeeding the child? What is his physical activity? So, sir, once you are able to probably zero down onto the factor that it could be a lifestyle related obesity, and generally to just tell you that these children would be tall and obese both.
Okay.
Right. That's why, in the class also, we do see a set of children who are overweight or obese. They will be tall as well.
Okay. So you need to take the height also as a parameter.
Also.
So it can opposite also. It can be opposite.
Correct.
Means the child can look very lean.
Yes.
But can be appropriate for age.
Yes.
Means that weight might not be matching his height. So
absolutely.
It's not only about being fat. You also have to take the height into consideration.
Yes. Because if you take 2 children, the one child who is very tall, his weight may be the same, say for example 30 kgs,
Hmm.
a tall child, and 30 kgs maybe a normal or a bit shorter child. So for this shorter child, these 30 kgs would be actual obesity for
Okay,
him.
got it.
So this is wherein the factor of body mass index helps,
Exactly.
because that is like a ratio of the weight to the height, and that is important.
So I got the
Because,
point now.
yeah.
What you wanted to say is just don't give too much importance to weight alone.
Yes, yes.
You check whether the weight for height is matching or not,
Matching,
and then
yeah,
match
yeah.
it with age.
Correct.
So we say that at 10 years a child should be 30.
Correct.
But if the child is too short,
Too
means the
short,
child is having a
yes.
height of a 6-year-old or a 7-year-old,
Correct,
having
correct.
a weight of a 30, still is
Yes.
considered as an overweight
Yes,
for the child.
yes, yes.
So that is just not on the age, but it's
Correct.
all the weight for height.
Weight and height.
So I
as
absolutely
well.
got it. So
Right,
sometimes
right.
the child weight might be very much higher, but
Correct.
if he has got a height to match with it,
Correct.
it's still okay with it.
Yes.
You
yes,
got it, ma.
sir.
Thank you for
Right,
that insight,
right.
because this is something which might not strike us. So
Correct,
BMI is
correct.
something which also be taken into consideration.
Yes,
Just weight
yes,
and height is not
yes,
important.
yes,
Excellent.
yes, sir.
So in addition to it, see the challenges. I think I
Right.
clearly understood as far as weight and height
Yeah,
is. I'll
yeah,
give you the
yeah.
bottom line. What I understood from your conversation
Yeah.
is if the child is absolutely active,
Correct.
he's metabolically active throughout the
Yes.
day, doing all the things, learning all the things, doing all the right things, eating the right food,
Correct.
eating the right food, sleeping
Yes.
the right way,
Yes.
doing everything,
Yeah.
and his weight is here and there, his height is here and there, doesn't matter.
Doesn't matter.
So only
yes.
if it crosses that BMI index,
Yes,
means
yes.
for his weight
Yeah,
and height,
yeah.
it goes abnormally high,
Correct.
high or abnormally low. I
Yeah.
think that's when we have to refer it to
Refer,
based on
sir.
the growth
Yes,
chart.
yes.
So for us pediatricians, growth charts are important.
Important, so very important.
Yeah, so we have to
Yeah,
see
yeah.
that the child is between 25th
Yes.
to 75th percentile.
Percentile.
Within that.
Yes, yes.
Anything
yes.
crossing that, sudden rise,
Sudden rise
jump.
is also, yes.
Gradual is okay.
Correct, correct.
Thank
sir.
you.
Yeah.
So in addition to it, what I would also like to ask you is, as far as the growing concerns, parents nowadays, the main concerns as far as endocrine disorders are concerned, the
Yeah.
moment we remember an endocrinologist,
Correct.
yes,
Yeah.
normally is for the growth and weight.
Right.
Then we remember them for thyroid issues.
Right, sir.
These are the common issues. When the child either is too fat or not growing, height is
Correct.
not there, growth
Yes,
disorder,
yes.
or there is a thyroid issue.
Correct.
These are the concerns which we normally refer to you.
Right, sir.
So
Yeah.
that is a time when we immediately remember, because we need your help in order
Correct.
to handle it. We
Yes.
alone cannot handle it.
Yes.
What do you think? Because field of pediatric endocrinology is broad.
Yes, sir.
So we wanted to understand as a pediatrician and also as a parent, what else are there in addition to these disorders?
Yeah. So pediatric endocrinology is very vast. So these are the commoner problems what you have just mentioned, like growth concerns, like pertaining to height or weight, diabetes, and thyroid problems. Apart from this, I would say, sir, like problems related to puberty. So like it could be either
True.
early puberty or
True.
delayed puberty
True.
in both boys and girls. So this is a very important part of endocrinology. Then others being like bone problems. So children having frequent fractures or having bent bones, like what we call it rickets,
Oh, yeah.
right? So either it could be due to vitamin D deficiency problems, or it could be some genetic bone
Or
problems.
there might be growing pains also.
Growing pains as well. Yes, sir.
Hmm.
Those, and also like problems related to any other endocrine gland, because there are like various other glands like adrenal glands, pituitary glands, like which release like
What
certain
problems do you see with them?
So, for
normally?
example, adrenal
So
glands.
that we can identify
Yeah,
very easily.
yeah,
That's what I
yeah.
want.
Right, right, sir. So, in adrenal glands, I would say congenital adrenal hyperplasia is one entity, which I would say should be diagnosed right at the newborn period.
True,
Yeah, because that is something very life threatening, which requires treatment right at the newborn period. The treatment has to be initiated. So I would also say, so this brings me to one more important entity in pediatric endocrinology is about the genital problems, like
exactly.
ambiguity. So if you
Genital
can't
ambiguity is another growing problem.
distinguish
Yes, true.
between like if it's a boy or a girl,
it confuses
right?
children.
So that confusion, it's very important as an endocrinologist to properly sort this issue and
Definitely
offer
challenging
treatment.
also at both
Yes,
ends.
challenging also. And also problems of pituitary gland, I would mean like growth hormone deficiency.
Yeah.
So growth hormone is produced by pituitary gland, which is called as the master endocrine gland. So growth hormone deficiency can present with short stages, very severe. The children are like very short, and they require this growth hormone injections for the treatment. And also there are certain syndromes which need help from an endocrinologist. So some of them being Down syndrome, Turner syndrome, or Prader-Willi syndrome. right? So
They'll
they
also
need,
have these, other
yeah,
underlying endocrine problems
correct,
also
sir.
associated with it.
Yes, yes.
So, see, what I could understand is we undermine endocrinology a lot. Frankly speaking, according to whatever base information is, endocrine is nothing but the entire hormones. How do
Hormones.
they work? They're regulated. Because
Correct.
without hormones, our body doesn't function.
Doesn't
You want
work.
your kidneys to function well, you need hormones. You need your
Yes.
heart to function well, you need hormones. You
Yes.
need your lungs, you need
Yes.
your GI system, the GI
To
system to function
yeah,
well.
yeah.
You need your important aspect, your brain to
Brain
function
as
well,
well,
whether it is
yes.
whatever it is, serotonin or dopamine or whatever it is.
Yes.
You want anything to function well, you need hormones.
Hormones.
So hormones make every cell function efficiently, every organ function efficiently. So
yes.
if it is working as a well-oiled machine,
Correct.
then your body is perfect.
Yes.
If there is any disturbance anywhere, that's when the hormones will go for a 6,
yes,
and that's when
yes.
we'll start having a problem.
Problems.
Right
yeah.
from increasing your BP onwards,
Correct.
having sleep disorders,
yes,
mood disorders,
right,
understood, and any puberty related issues.
Issues,
These
yeah,
are some things.
yeah,
Okay, this is
correct.
something which
Yes,
I really
yes.
understand. So hormones are really, really important. So you are
Yeah.
also really, really important for the pediatrician. Coming to the next aspect.
Yeah.
As you rightly said, it's not only about thyroid and all these things. We'll
Correct.
discuss about thyroid a little bit later,
Yeah,
because this is
sure.
something, another concern growing
Yeah.
parents is the puberty.
Yeah.
There are certain myths around it.
Yes.
I'll also ask it.
Sure.
We'll also have it later on also, the same
Sure.
questions. Right. See, puberty related questions, parents are really concerned.
Yes.
What is the right age is something the parents are confused.
Correct.
Because the moment we see that there is an early change, see, normally parents, what they come to me?
Yeah.
They come to me with a pain in the chest bud.
Chest. Yeah.
So,
yeah.
areola bud, they will have a chest bud problem.
Correct.
So, they have a pain near the areola, the
Correct.
nipple area. They have the
Yes.
pain near it, and they feel that it's some lymph node or hardening is there.
Yeah.
That's an early stage of the development.
Correct.
So, the moment I say that, this is something the parents, sir, why at this young age? The
Correct.
child might be
Correct.
around 8 years or 9 years at that
Right.
point of time.
Right.
And sometimes they might have premenarche pain. You can
Yes.
explain me what is the right age? Do they have a pain premenarche? How long
Correct.
it is?
Yeah.
So they are really concerned, especially about girl children. I don't see this complaint in boys because
Yeah.
they're okay with it.
Yes.
But girls, they're overly concerned.
Concerned. Yeah.
And
yeah.
there are a few other myths surrounding it. We can discuss it as going
Discuss it,
forward.
sure.
So for me, right now is what is the right age
Yeah.
to attain puberty? Youngest
Correct.
and the latest. Because
Correct.
sometimes I do
Correct.
come across parents again adding to it
Yeah.
that my child is 13, 14, 15 years,
Yeah,
still not
yeah.
has achieved her menarche. Is it
Menarche.
okay?
Correct.
So please tell me the youngest age and the oldest age
Oldest.
as far
Correct,
as puberty in females are concerned, because
Correct.
boys are not really
Yeah,
concerned.
yeah.
It's the females which
Yes,
really
yes,
concerns most
yes.
of them.
Correct, correct. So in puberty, now let's touch upon two aspects. Like one is called as like when are the first signs of puberty that you see? So these are something we called as secondary sexual characters. So this would include, like as you said, the first sign would be the breast bud development in the child. And sometimes the child may pursue it as a pain. Some children may not pursue it as a pain, but the parents may notice that the child has started to develop a breast bud. So usually if this feature occurs after 8 years of age, it can be considered as normal, sir.
Normal, okay.
Yes,
At
after
8 years. Okay, got it.
And other features of puberty again being like, developing underarm hair or pubic hair, or having like, pimples on the face, or having a body odor like an adult. So these are all also like other features of puberty. So if these features develop after 8 years of age, I would generally reassure the parents that, there is nothing to worry. We
It's
can
okay.
wait and watch. And many times, the mothers come concerned to me that, oh, my child has developed a breast, but now is she going to have periods in the next 1 month?
True,
right? So it's very important to again like tell them that, it's a long period of time. Like from the time the child develops the breast bud till the child has her first period, the gap can be anywhere 2 to 2.5 years.
Got it. Now that's clear. So
Right?
if it starts at 8, it can be
Yes.
something around 10, 10 and a
10,
half, or
10 and
11
a
years
half.
also. That's the
Right,
maximum
right.
period you can
Yes,
wait. Okay,
yes.
Got it.
And only like in a very small subset of children, I would say that, if the pace is very fast, like, a very rapidly, like the chest is developing, and also they are developing a white vaginal discharge, and they are on their way to develop puberty within 1 year of age, then that is something abnormal. But this is a very small, rare subset
Rare
of
substance.
patients. But 99% of the children, like they will give a time of about 2 to 2.5
2.5
years before the
years.
period appears.
Can I know the sequence? Because
Yeah,
that is
yeah,
also
yeah.
important, because
Correct.
everything is a concern for the parents.
Yes,
So
yes,
first
yes.
is always the breast development.
Breast development.
Next thing is the hair development,
Hair
whether armpit or
development,
pubic
yes,
hair or
yes,
whatever,
yes.
right? And then comes the menarche.
Menarche, yes.
I'm going by the
yes,
sequence,
yes, right?
Okay,
sir.
now I understood.
Yeah.
So now, see, people are not really concerned about breast and hair also.
Correct. But
Many are
menarche.
more importance is given to menarche, though all are the same.
Yes.
Now I
yes.
wanted a real specific information
Yes,
as far as menarche is concerned. What is the youngest stage? What is the oldest stage as far as
Correct.
menarche is concerned?
Yes. So youngest age can be considered as per nine also.
9 years.
Yes,
Okay.
9 years, youngest age, and oldest age can be considered up to 14. But also we do see some children like having their periods at 15 as
So
well.
is it a problem if it is delayed?
So
concern?
if there is for example, if the child is very well good, and if there is a family history that the probably like the mother or the sibling also has had a period at 14, 15, then we are really not worried. And if the child has developed all her secondary sexual characters well enough, she's already going in the proper path.
Okay.
Then that is fine. Then we are not concerned.
Absolutely.
But for example, a child of 14, 15 who has not even developed a breast, then that is
then
something,
definitely there's a concern.
there is a concern.
Concern, right?
Yes.
So there's one more question to follow up with it. Is, see, normally my experience, you can correct me if I'm wrong. See,
Yes.
we might be right, we might be wrong, but I'm trying to give my experience and opinion. I see the children before achieving menarche, they have this stomach pain, which is a very common thing.
Right, right.
Cyclic stomach pain. They have it below the umbilicus.
Correct.
For a few days together, and it repeats.
Right.
And unfortunate thing is they undergo scans, they undergo lot of tests, lot of medications.
Right.
Can you just enlighten me how long is fine? Is it okay? Will they have a stomach pain, abdominal pain, lower abdominal pain?
Some kids may have. So usually what I say is like, now sir, the same the sequence of events what we were discussing. So first breast development happens, then the hair development happens, then the child has beginning of the height spurt, and then towards the last 6 months before the onset of periods is something where the white vaginal discharge starts. And in that period coinciding, probably this child may also complain of the cyclical stomach pains.
Okay.
But I would say, sir, like I do see in maybe like 25% of the girls, not many though, not many. But I think it is unnecessary to go for the.
So any menarche before 9 years is a concern.
Yeah, before 9 years is a concern.
Now I will ask the controversial part.
Yes.
Right. So parents are concerned. A lot of social media posts are there. Even my wife is concerned. She keeps shooting me that this is something which we should be careful. This is what is happening. My wife is a gynec though, but she stresses on these points.
Right.
So I would like to ask you for the knowledge. Junk food.
Yeah.
Okay. Milk, dairy milk.
Right.
They believe a lot of hormones, eggs.
Yes.
Right. Even chicken to a certain extent,
Right.
where they believe a lot of hormones are injected for to increase the weight of the chicken, for the eggs to be laid on a continuous basis. Hormones are injected, estrogen is injected. Even junk foods are having a lot of things. Do they influence early puberty in children?
Yeah. So this is one of the most controversial topics, I would say. So yeah. Because definitely, sir, there is like these dairy as well as eggs and the poultry, everything is treated with hormones. But then to corroborate, like, whether it is directly causing the early puberties, it's very difficult to say because we don't have like many studies. But then, like, definitely, and it's very difficult to, just take everything off the diet as well, because sometimes I do face questions from parents that, okay, look, I think like I'm exposing my child to these hormones, so let me stop eggs, let me stop milk, and let me stop chicken.
Otherwise the child will not grow.
So that becomes a little tricky.
All or none phenomenon.
Yes, it's an all or none phenomena. So it becomes very difficult to answer this question, whether because we know that there are hormones being injected to them, but then like the scientific studies have not directly established a causation that because of this the early puberties are happening. Junk food, if I tell you, because junk food is causing more obesity, and obesity could predispose
So it's indirect.
to, it's an indirect.
So all children who are obese are prone for early puberty, obviously, because
the body feels like, okay, now the child is
Got
ready for the puberty.
so I understood the point. So
Yeah.
when you hit the hormones are you should treat the hormones really well in your body.
Correct.
So you
Correct.
should make it like a well-oiled machine, as I rightly said.
Yes.
If that hormone imbalance happen, you're
Yeah.
eating too much of fatty food or
Yeah,
too much of
yeah,
food with
yeah.
decreased activity,
Correct.
automatically what happens? A lot of
Yeah.
fat deposition happens.
Yeah.
A lot of fat
yeah.
deposition happens, then the hormones also will go for a six. So you'll end up having this puberty, because
Puberty,
hormones,
yes.
more hormones means early
Correct,
puberty.
correct,
So this
sir.
is what I think I can understand. You can get me right.
Sir. And also one point I want to add, sir. So this is like I was talking, we were discussing about the egg, milk, and chicken, but also in pure vegetarians also, we have found that even those children come with early puberties, because there is something called as endocrine disruptors.
Okay.
Endocrine disruptor chemicals, like as per few studies, they have been found even in DDT related pesticides.
Oh, means the food, normal food we eat, the vegetables.
Yes, normal
and stuff
vegetables and stuff what we eat. So we actually don't know like where all the disruptors are coming in from. Yeah. And also even the plastics, the polyphenols also have been found to have the endocrine disrupting properties.
The xenobiotics.
Yes.
So it's really concerning for me now. The real concern here is what to eat.
Exactly.
So you look at social media, one day a parents will come and say, sir, milk पीने से मेरे बच्चे को ये प्रॉब्लम होता कहते, थायराइड प्रॉब्लम और एंडोक्राइन और वेट का प्रॉब्लम, हार्मोन का प्रॉब्लम होता कहते. So milk बंद कर दिया. Other day another parent will come, sir, we have stopped all eggs, we have believed that these are the hormones which are Other day another parent says that we have stopped all chicken and all that stuff. Now another set of parents are saying that nowadays we are not giving certain foods. So these things go on.
Sir.
Go on. So I say, slowly you take away all foods. So fruits, they are injecting a lot of dye. It can cause a lot of problems in the children. So fruits are gone. Eggs are gone. Okay, chicken is gone. Milk is gone.
What should
the child eat? No, even breathing air is a problem, because air itself is, and water also is contaminated. So what are we supposed to take? So my take, you can correct me, my take would be, whatever is the healthiest option available to you within your affordable range. Don't try to go in the name of organic. Don't kill yourself. My take is, you grow your own foods as much as possible, if it is possible within your vicinity. Understood? And milk, as far as milk is concerned, you trust the person who is the nearest. Means you have to have a trustworthy person who can deliver a good milk for you. So there's a thing called A2 milk nowadays, which is devoid of pesticide hormones, but I don't know how far the facts and checks. But please don't deprive the child of essential nutrition. On one side you stop all this, another side the child is eating chocolates, biscuits and this stuff like that. Doesn't make any sense at the end of the day. If he's eating ice creams, doesn't make sense at all end of the day. It's better he eats this than
eating the junk.
So it's something which I think we should look at. Okay? Yes. Organic, if it's available, you are affordable, it's really good. But please don't deprive the child of essential nutrition in the name of toxins. It's always a trust factor which plays a role there. I think I got that point. Coming to the next aspect, or the next challenging aspect, is a thyroid problem. See, I have to tell the story at my end also. I'm a pediatrician, right? I've seen that a lot of children are having thyroid issues nowadays. So I'll tell you about my story. And then I think you can add a few things. Right? My story is, my elder child, as I said, we are very conscious about what goes in and what goes out. The diet, the food and all that stuff. So he is being our first child, and we were always very conscious about what is going in. We actually avoided junk and stuff as much as possible. So we always assume, because we are not giving him any junk, we are very conscious about what is going in. He is always on the leaner side, and he is not taller. For a long time, that my child was not actually growing tall. And I've seen that even my clothes don't change. But I always had a suspicion that maybe he's having some hormone issue. Why is he not growing? So whenever I wanted to do a test, my wife was against it, saying that no, it's okay. My grandmother, my grandfather are also a little bit shorter. It's okay, genetic wise, it's okay. So we tend to stay back. Unfortunate thing is, I never seen his class with his friends. Maybe I would have caught it. So when in first class, because this all started till 4 years, I think there was no problem. But when he reached his first class for the 2 to 3 years, 2 years, suddenly went to his first class, I see that he is at the shoulder level of most of his classmates. That was a shocker for me. And that's when I realized there is a serious problem for him. And 6 years, almost is crossing 6, he had issues. But only thing what he was working against is, according to me, thyroid means the child should be a little bit dull.
Yeah, yeah.
Okay, and memory should be a little bit on the lower side.
True.
He should be constipated, he should be
Yeah.
having skin issues, he should be
Yes,
losing hair.
yes.
My son had the opposite of all that.
Opposite.
He had a thick hair, never constipated,
Yeah,
he was
yeah.
very brilliant,
Yeah,
he was very stable,
right.
he was, he was hardly, never used to be very naughty.
Correct.
Understood? He was very
Yeah.
stable and very mature for his
Yeah,
age, and he used
yeah.
to stand almost on the top grades, get top grades in the class. So
Yes.
it was something which was pushing me against.
Correct.
And
Correct.
when I got his thyroid test, after seeing with his classmates, I was
Yeah.
shocker is thyroid was abnormally high. The TSH
Oh.
level was abnormally high.
High.
Me being a pediatrician,
Okay.
me also looking at various aspects, we
Right.
can get confused
Yes,
because
yes.
nothing comes like a textbook.
Correct, sir.
That's when
Absolutely.
I think I looked back, and then I figured out that being stable
Yeah.
and being very more mature than the age,
Yes.
not really being very naughty,
Yeah.
is also not normal. So when we corrected his thyroid,
right.
his height got corrected. God's
Okay.
grace, he is now 6'1" right now. He's got a good height. There's no
Wow.
problem because on
Yeah.
timely we diagnosed it.
Correct.
But he has become extremely naughty after that.
Okay.
It was very difficult for us to
Yeah,
handle him.
yeah,
He
yeah.
became very notorious.
Right.
He was crying. He was
Yeah,
shouting. That
yeah.
was his normal thing. It's a
That was his
thyroid which was
normal
actually
self.
masking it, which
Correct.
was a shocker for me as a
Yes,
pediatrician
yes.
because we read something else
Yeah.
and we find something else.
Correct, sir.
We learned
Yeah.
out of experience.
True, true.
So height, I think, according to me, should be measured at every stage.
Every stage.
It should be matched with weight, and if it
Correct.
is going below the line, they
Yes.
have to be checked.
Correct,
So
sir.
that's the reason why we
Yeah.
encourage parents to come regularly for a checkup.
Checkup,
So
sir.
coming to
Yes.
thyroid disorders,
Yeah.
which is a growing concern
Right, sir.
among most of the parents,
Yeah.
what are the things other than the example which I have given?
Correct.
Okay, what is the earliest age? Means what are the general signs of thyroid
Right,
disorders?
sir.
Very general.
Yes,
Means
yes.
where the parents can pick up very easily by looking at it,
Correct.
and they have to visit their pediatrician
Yeah,
if there is
yeah,
any
yeah.
concern.
Correct.
Okay,
Correct.
when is that you should do it?
So as you said, sir, like that's what, like we do hear of all these textbook symptoms wherein, like, there is constipation, dry skin, hair loss, mood changes. So very few kids actually present to us with these symptoms. Rather than more concerning problems, what I have like heard from the parents is sometimes there is a rapid weight gain where I have like seen. Second, height issues, sir, I don't see it in the beginning stages because unless the hypothyroidism has existed for quite few months, then the height problem starts.
Okay.
So they may come with, as I said, rapid weight gain. And second could be like slight academic issues, sir. But though I have seen like even children with TSH more than 100 being still the toppers in their class.
Yeah, that's
So,
the confusing point
yes,
because we are
yes.
always thought that anybody who is
yeah.
having thyroid problem will be
Should-
mentally slow.
Correct.
So first question a
correct.
pediatrician asks is how does the child academically perform?
Perform, right.
So the child can have a hypothyroid issue,
Yes.
but still can be academically really bright.
Really bright.
That can be a
really
blessing
bright.
in disguise because they will not be
Yes.
distracted very
Correct,
soon. Yeah.
correct. Others would be, sir, like sometimes parents say that, my child is more tired in general. Like usually, like, many times, like it's after they come back from the school.
And appetite also?
Yeah, appetite also. Sometimes they say that, not showing interest, I have seen. Like not,
So there will
yeah.
be contrasting features in my
Contrasting
experience. Means the
features,
child
yes,
here in
yes.
thyroid problem will not be eating much,
Exactly.
but will be gaining a lot of
Gaining
weight.
lot of weight.
And will be
Yeah,
getting
yeah.
easily tired
Yes,
and wanted to
yes.
sleep a lot.
Correct. Sleep a lot.
That
Yes,
is something
yes.
which I normally
So what I want to suggest, sir, like, like as parents are the first doctors. So you must trust your instincts, like, because you have seen your child, you know your child so well that I feel that, like the first thought or the first instinct that comes to your mind, you must follow it. And even if you have slightest doubt, then like I think we must
always visit
yeah,
them.
always